Contrast therapy for lower back pain is what we're going to be talking about today on this episode of the podcast. We've got a number of things on the board behind me so that we can cover everything. Hopefully you guys are going to find this episode particularly helpful. There will be timestamps underneath so you can navigate to the part of interest, and also there is a full article breakdown which will be on the website as well, link in the description. So we wanted to kick this off because contrast therapy is a great tool that we can all use to help reduce our lower back pain. It's used all throughout sport, for other injuries, in other industries, and really when it comes to lower back pain, there are some particular nuances which we'll get onto a little bit later on that contrast therapy can really help for those of you with specific lower back pain diagnoses. So we're going to explore it in a little bit more detail, how it works, etc., and go from there. So the very first thing we want to look at on the top side of this board is what contrast therapy actually is. It is a natural mechanism for us to reduce inflammation, to reduce pain, etc., in the lower back. If we're suffering from lower back pain or sciatic symptoms, it's free. More or less all of us can actually do this. We've got a kettle at home, a microwave, some means of accessing hot water, and the same obviously a freezer, fridge, etc., to get the cold. It is accessible and has no side effects, so we can all do it. We can all get access to it. It costs us next to nothing. It's natural and it doesn't come with side effects. Also, although if you do put the temperature up too high or too cold, then there could be arguably some there, but that's generally speaking a bit of a user error. So that's the first and most important thing. And why is that important when it comes to lower back pain? Well, for a lot of people with lower back issues, beyond that initial injury, i.e. you just injured it for the first time today, much of the pain that we experience, the relapses that we get along the way, or the reoccurrences are really down to excess inflammation building up in the spine. I've got the spine with me here. It's generally this lower section of the lumbar spine and some of the peculiar architecture, which we'll get onto later on, of that lower back. The fact that we've got these bony spaces and inside here is where we've injured, as opposed to say the wrist or the elbow, etc. It's the fact or the feature of where we injure, where we are injuring when we have low back pain, that really makes these tools, contrast therapy, the hot and the cold altering, particularly helpful. So essentially, when we're talking about contrast bathing, we are using the mechanisms that happen when we use hot. So we've got hot up on the board here. So we're going to increase circulation to the area. We're going to reduce any muscle stiffness that's there. And we're more importantly going to be bringing with that circulation new resources, oxygen, the immune system, etc., to provide nourishment to that particular area. If we've got tissue damage or injury in that section of the lower back, then we're going to have white blood cells coming in there, doing phagocytosis to remove some of the cellular debris, to clean that area out, and obviously, as we mentioned a moment ago, fuel that regenerative process. We can do this very easily. We can do it using a hot water bottle. We can do it using a heat pack. And also we've got whole body mechanisms, which we mentioned in the article. I won't go into great detail here, such as the sauna and the infrared sauna, to get sort of whole body access to heat. And fundamentally, these mechanisms are working by way of a process called vasodilation, which is where the blood vessels open out in response to this increase in temperature locally, or in the case of something like a sauna, in the whole body. And we see this process occurring naturally in the human body, in you and me, of its own accord. For example, if we're going to the gym or if we're running for the bus, etc., our body will naturally undergo vasodilation, which we're mentioning here, and vasoconstriction in other areas to divert blood from our digestive tract, which is utterly useless when we're running for the bus or engaging in sporting activity, to our muscular system. So the body naturally does this anyway. We're just getting in using hot and cold to manipulate this process. When it comes to the cold, we're getting a vasoconstriction happening, a decreasing in the size of those blood vessels naturally, and we're getting a reduction in the inflammation, in the local swelling, in the congestion as a result. And what can we use here? We've got peas, a pack of frozen peas is the common one because it'll bend to the area that we're using. We've got an ice pack. You can pick them up for 5, 7, 10 pounds, something like that, off Amazon, the flexible ones that you can reuse over and over again. Or if you've just got something cold in the fridge or freezer, you can just stick that straight on your back and that'll do the job. And then again, we've got those whole body variations, which are becoming more and more popular, just like the saunas and infrared saunas. We've got the cryotherapy chambers. We've got the ice baths that you can have at home. And there are many places which do cryotherapy in those they look like a sunbed or a cold version of a sunbed that you can go in and they'll bring your temperature right down using those there, as well as another way of getting that cold exposure. But all contrast therapy is alternating between that hot and between that cold. And where we're using it for our lower back pain, we're using it to intervene specifically in a target area. And in the case of lower back pain, it's going to be down in this region of the lower spine. So what do we want to think about when we're thinking about lower back pain specifically is that inflammation is a good, natural, and normal process. There does seem to sometimes be this air of persecution when it comes to inflammation. Inflammation is bad. If you've got to reduce inflammation, you've got to reduce gut inflammation, here. Inflammation is a natural process, but out of control inflammation, and in the case of a lower back injury compared to other injuries, excessive inflammation for the geography of the region is important. Now, when we have the lower back, it's different to the knee or the elbow or the ankle, other areas that frequently are injured in sport. And with those areas, they're like a balloon. We've got, let's say it's the knee or the elbow. We might have some bone on one side of the space that's injured, but we've also got a lot of soft tissues on the outside. Maybe it's sort of the wrist here. We've got some bone on the inside, but we've got the soft tissue in the skin on the outside. And therefore, we've got lots of plasticity, lots of elasticity for inflammation to cause a degree of swelling. There's a lot of accommodation for that excess fluid in that region. As uncomfortable and as stiff as it might be, it's not necessarily going to be a bad thing unless it reaches extreme levels, visible levels, notable levels, which we've all probably seen if we've ever sprained an ankle or wrist, etc. over the years. But when we have the lower back, we have this bony architecture. We have these finite holes. You can see them here. They're not going to swell to the same degree at all. They're more like an elevator, as I mentioned in the article. We're plugging, if you try and stick one or two more people in that elevator, it's going to be unhappy. But if you stick a little bit more air or a little bit more fluid into a balloon, it's going to stretch and accommodate. And that's the big difference when it comes to the lower back injury versus other injuries, and why you'll often see, we'll just use heat, do these things when we have injuries, and that's just applied to the lower back without consideration for the architecture, the lay of the land in the lower back and how it's very different to other areas. And that leads us to do things like forward bending, etc., which I won't get into here, but we've touched on many times before in the podcast through exercises like knee hugs, child's pose, etc., and why they're understandably recommended, but bad, period. So your spine is different, especially as when we have cases like sciatica where people can get caught out, really targeting the leg rather than the lower back, and we'll get back to that in a second. But the mechanism of contrast therapy allows us to intervene and manage that inflammation more effectively in cases where we don't want it to reach unnecessarily high levels and therefore give us symptoms. Because as I mentioned earlier, the majority of cases of lower back injuries flaring up, it is the inflammation. You've had an MRI report, they've said there's a disc bulge, but it's not pressing on the nerve. Why do you have nerve pain then? Why? Because there's excess inflammation aggravating that nerve in a confined space. Utilizing contrast therapy can help reduce that so that we don't have the same level of symptoms, and it's natural and pain-free, as we mentioned, natural and side effect free and easily accessible, as we mentioned at the very outset of this video. The one cause for concern or cause for attention would be in the case of sciatica and those that have sort of glute buttock region discomfort or pain or symptoms. And that is that all too often people will chase where the symptoms are. So you'll try and apply the contrast therapy to the leg where it hurts or where the burning sensation is on your skin of the shin or big toe. And that is the wrong location. We must apply contrast therapy to the region where the injury is located. And therefore, if you've got sciatica or any of these other conditions, you've got to target it to the lower back. And generally speaking, it's L4-5, L5-S1 region, the last two mobile segments of our lumbar spine where we have injured. And that's where we must apply the contrast therapy. We can get away with it if we're using things like pills, anti-inflammatory medications, etc., by just popping it because it affects everything. But the big problem with that is that inflammation, as we mentioned, is a good, natural and normal process. It will be taking place throughout your body to support the general function turnover within your body at all times. And the problem with taking a systemic one, aside from the effects on the gut, we could say, is that it is affecting everything and it's impairing a normal natural process, a process that all we're trying to do in the case of the lower back pain or sciatica is just control and manage it a little bit better. And medication doesn't allow us to do that in an effective way that is only focused on the region that is injured. So something to think about there when we're comparing it to other mechanisms of getting this inflammation under control. A couple of conditions that you want to think about if you've got lower back pain diagnostically is anything that's going to result in a degree of spinal stenosis. So if that's a disc bulge, if it's facet hypertrophy, if it's a spondylolisthesis, those sorts of conditions that create a degree of stenosis are going to make the holes that you have, the bony boundaried holes that you have in your spine where your nerves are going through, is going to make those smaller. So if you have smaller holes, the inflammation from a lesser scale of injury is going to fill those holes up faster. You're going to experience pain more quickly, you're going to experience arguably more pain, more debilitating symptoms, which are more disproportionate to the actual severity of the injury. You'll experience pain up here when the severity of the actual tissue damage is very, very low. But because there's a lot of inflammation in a small space, a smaller than usual space, you suffer more. So being aware of this is really quite important. And then utilizing the tool is again going to be helpful as well. So getting down into the point here of actions you can actually take. Well, we did a full podcast episode on the step-by-step in a little bit more detail, but covering it briefly here, we're going to find the right spot, which is going to be right down here. We find those two bony bits at the base of the spine. Those are the PSISs, often the dimples on our lower back. We're going to come up about 1 inch because that's not where the lumbar spine is. That's the sacrum, and we don't injure that. We injure up here, and it refers pain down here. So another example of kind of sciatica on a smaller scale. And then we apply the hot for 3 to 5 minutes here, take it off, put the cold 3 to 5 minutes here, and we can repeat that cycle 3 times through. You can do it as often as you want during the day. Sometimes when you're having a significant flare-up, doing it more frequently is going to be necessary, is going to be helpful. You might as well. If you're not able to do anything else, you may as well benefit from doing this and the time that you've got employing it in a way that's going to actually help you, as well as other things like the things we talk about in the Back in Shape program. But generally speaking, what we advise our members is to use this, generally speaking, 3 times a day after you do your towel exercise, your towel decompression for the lower back. It's nice and easy, and it's just a nice way of you complementing that recovery process. Now, there are some drawbacks when it comes to contrast therapy, and I've put them down here, and sorry, they are a little bit off the bottom of the board. And the 3 main ones all do one thing. One, it could potentially be a little bit of mess. You've got water melting, ice melting, water maybe leaking, etc., through the hot water bottle, whatever it may be. That affects compliance. We've got the temperature issues. I mentioned, hot, what's hot, how hot, etc., how cold, etc. Are we going to get some freeze burns or hot burns? Those things could happen. Generally speaking, they don't. It's an error. It's a user error. We can make sure we don't do those by just checking how hot it is before we apply it to the back. So those sorts of simple things, but they can put us off. And then finally, the effort, the palaver of going over there and then back to the fridge and then back to the microwave can put people off doing this. And all of it is that it affects compliance, and it just reduces the likelihood of you doing this. So we end up finding that it's only those with particularly in the throes of a severe back pain flare that actually bother doing this, when maybe more people could really benefit from doing it as standard on a day-to-day basis. Now, one of the things that we've done over the years from a clinical standpoint is we've always looked to use technology where it's more effective, safer, easier, etc., to deliver the same outcome. And one of the devices that we've been looking at recently, which we've mentioned on some of the other videos, is the RecoveryTherm Cube from Therabody. There will be a link in the description again to the full video where we talked about the pros and cons of that device specifically, because everything has pros and cons, and also a little bit of a demo on how you can use that device. But this is a thing that will take out, it's a little cube about that big there, and you put that on your back. It's got a strap so you can hold it in place. That removes the mess. It removes the temperature because it goes from 8 degrees up to 42 degrees hot, and it switches through that on a program. Super easy, just press 2 buttons and off it goes. So it does the job for you. And again, that final point, not sure with the temperature, but the effort, by just having to press 2 buttons and it delivering the contrast therapy for you, no thinking, no faffing, no messing around, it's done. It decreases the effort to do it. For some of you, at $150 to £125 in the UK, so $150 in the US, £125 here in the UK, it's something that's worth using. For others of you, it might be out of budget, that's fine, but there are cases of technology being able to help us deliver something more effective. And ultimately, these things, contrast therapy, many other things, the exercises that you're hopefully doing, they don't work unless you do them. The freezer pack doesn't work if it's in the freezer, it works on your back. So whatever we can do to increase our compliance allows us to benefit from the things that we're doing, so we can expedite that recovery process and get a smoother rehabilitation journey. And the final thing I wanted to leave you with, guys, before we finished, and I will say just before I get into this, any questions you guys have, as always, post them in the comments. We read and reply to all of those, and they help us guide and gear the sorts of podcast episodes we do to make them more and more helpful and usable for you guys. But you must do your exercises. Sometimes these things work really well. They get rid of all the pain very, very quickly, or they take a relapse all the way back down. But if you're not doing your rehabilitation work, you're not doing your strengthening work 3 to 5 times a week properly with good technique, progressing over the long term, over the weeks and months and years as they go by, you're not going to rehabilitate the lower back effectively. You've got to provide your body with the appropriate nutrition. You've got to support that recovery process, but it takes work. So this is a great tool. It's one tool that is going to help you, particularly if you're having flare-ups, expedite that recovery process, reduce levels of pain, and smoothen out that process of rebuilding your lower back. But you've got to do your rehab work as well. So thanks so much for watching. If you got this far, do let us know how you found the video, and consider sharing this with someone else who's struggling maybe with their back pain. Maybe they're having a little bit of a flare-up. They can learn a little bit about contrast therapy and how it could help them too. See you in the next one.